Okay, I am here with Jim Herkimer, physical therapist at SCAR, who I am interviewing today. Hello, Jim.
Hi, Aaron.
My first question for you is, what was your dream career for like your future? What did you want to like become?
Well, when I was in high school, I always had a big interest in sports medicine and had an opportunity to spend time at a community college in an internship and worked in the athletic training room at Santa Ana College. And this was a long time ago. It was back in the 70s when this was all kind of new. And that experience as a high schooler gave me the interest and the desire to go on and get a degree in athletic training and then a degree in sports medicine and then physical therapy and so I'm kind of doing what I'm doing is exactly what I thought I always wanted to do from the time I was in high school. I've taken some detours along the way, but I'm doing exactly what I thought I wanted to do even from high school.
So ultimately, you got your goal.
Ultimately, I've achieved that goal. Now there's new things to do, but in terms of the ideal job, I'm kind of living it.
Cool. What events did you like enjoy in your childhood?
Um, when I was a kid, we had a cabin in Big Bear, and so I learned to ski when I was young. In Big Bear, I learned how to ride motorcycles. So I was always pretty outdoors. Fished a lot, and those are things that I did as a kid that really, besides all the sports that I did, Little League and everything. Then one of the unique things I think that I had an opportunity to do as a young, I mean, some of my earliest recollections in life are in the front seat of a small airplane. And when I was 15, I was given the opportunity to start taking flying lessons. So I soloed a small plane when I was 16. I got my pilot's license when I was 17. Yeah.
Wow, is that like really hard to get that?
It's like getting, it's just maybe a step up from getting a driver's license, but it takes about 40 hours of flight time, and learning to fly back then in Orange County is different than it is today. There's a lot fewer airplanes in the air, and not as many airliners, and so the rules to fly were a little bit different back then than they are today.
Cool. I like that. What colleges did you attend, and what were your majors?
Well, I went to undergraduate school at California State University, Sacramento, and I was an athletic training major. And then after I graduated from there, I went to Chapman University and got a Master's of Science, an MS degree in sports medicine. And then after I worked for a little while, I went back and got a master's degree in physical therapy from Chapman. And then after that, I went back and got a doctorate degree in physical therapy from the University of St. Augustine. So yeah, because 4 degrees just doesn't seem to be like enough.
Yeah. And that was a doctorate there
at St. Augustine.
University
of St. Augustine, yeah.
Cool. What made you decide to become a physical therapist, and what steps did you take to become one?
Again, I always had this, inherent interest to be in around athletes and sports medicine, and prior to going to PT school, I worked as an athletic trainer for some time, and I felt a little bit limited just as an athletic trainer, and wanted to have the opportunity to have more breadth in the types of people that I could treat. So that was when I went back to PT school. Physical therapy school will give you a little bit more breadth in terms of the types of people that you can work with, as opposed to just athletic training. Athletic training is really focused just on an active population. And so I, kind of did the steps necessary to get into PT school, which was the prerequisites. And, if I had to retake any classes, which some of my classes had expired, I had to retake anatomy and retake physiology. So just taking those prerequisites, having a good science background.
Is kinesiology a major subject that's discussed in physical therapy training?
Yes, it's in fact, I've been the kinesiology professor at Chapman in the PT school. I've taught the kines class a couple of different times. So kinesiology as a course, which is really just the study of human movement, is a core component of what we do in physical therapy. As an undergraduate degree, you'll see a lot of schools that have kinesiology as a major. I mean, my BS in kinesiology, for example, and that's a broader basis. So that will typically encompass biomechanics and will encompass a kines class as well as exercise physiology and a variety of kind of movement specific, with science applied. So you get to utilize your physics functionally, to utilize chemistry functionally, how it works in an exercise environment.
How has kinesiology helped benefit yourself and patients?
Well, I think one of the things that kinesiology does is it provides an opportunity for you to look at how we move and how we move in a functional manner. In other words, if I look at in an anatomy book and I want to know what your quadriceps do, or your calf does. The calf is a good example. And the description in the anatomy book will say that it points your toes, it plantar flexes your foot, points your toes down. Well, how often are you walking around where you're just pointing your toes? Not very often. So functionally, the calf actually helps to control what the knee is doing, and it helps to actually control what the hip is doing. So kinesiology takes the definition in anatomy and the anatomical position, what it does, where it attaches on both ends, and then applies that principle to how we use it functionally. So when you're walking or when you're jumping, which is different than what its action is, just laying on a table.
So it's pretty much just like based off like anatomy.
Everything is think of it as like functional anatomy. So you have to know origins and insertions and what the action, but then you have to know what the action is in activity.
So what would you say about the ratio of people of just like normal people getting injured versus like athletic injuries?
Well, that's a great question. Anytime somebody's playing a sport, there's always an increased risk for an injury. People running into each other. One of the things that we see a greater frequency of is non-contact injuries, where somebody cuts and their ligaments are compromised and they tear. An ACL rupture, for example. So with a greater number of people participating, we see a greater number of those injuries. 30 years ago, there was 10 million kids playing sports in the U.S. In the 10 years ago, there was 35 million. So 20 million more kids participating in sports is going to, there's going to be a higher incidence. Now, is there a higher percentage of kids being injured? I don't know, but I do see a lot of kids that get injured because they're only doing one sport. So they're not cross-trained. They're playing soccer, and they're playing soccer year-round. So they're doing the same movement pattern over and over and over, as opposed to playing soccer and then running track, maybe playing basketball. I think that we would see a lower incidence of overuse injuries if kids were only playing, if they were not just playing one sport, if they were playing multiple sports. But for some reason in this country, we've decided that kids at 6 years old have to specialize.
So you're saying that multi-sports would help decrease injury?
I think so. Yeah, I think so.
So what would your average be for the amount of patients per day that you treat for like these type of injuries?
I see typically about 16 or 17 per day of a normal caseload, and that normal caseload will include people if somebody may have had a total knee, maybe an elderly patient, and then a group of athletes.
You're actually seeing like total knee replacements?
Yeah, total knees, total hips. Yeah.
Yeah, that's actually cool to see, but I wouldn't like to be patient. Based on the amount of patients you've had, what is the highest injured part of that? Of like where do they get injured the most?
Yeah, what's the worst? I see a lot of knees, I see a lot of shoulders, but the body part that is probably has the highest incidence is low back pain.
Really?
Yeah. But low back pain is typically not associated with an athletic problem as much. You know, it's more associated with a sedentary lifestyle, people sitting too long.
If it were to be like a severe like injury, what would the best place be? Mainly the knee?
Oh, I don't think there's a best place. I think they all have components that are detrimental. You know, shoulders have their own set of issues, hips, low backs have their own set of issues, knees have their own, feet, ankles have their own set. So I don't think you can say what's the best body part to injure, because I don't think there is one. Yeah.
So in your own words, describe to me how kinesiology affects and helps treat patients.
Well, again, when you look at that relationship, so I can see if somebody's calf is tight and how it affects what their hip is doing. I can address the calf and the hip at the same time with specific exercises. And when you look at kinesiology as a function of moving through 3 different planes, so we can move front to back, we can move side to side, and we can move rotationally. Those are planes of motion, and we have to be able to move through all 3 of those planes of motion, and we have to have strength and stability through all those planes of motion. And having a thorough understanding of kines allows me to look at mobility and stability through all those 3 planes. So somebody may be good in one direction, but they are falling apart in a different direction. Having a good understanding of kinesiology allows me to tease out where that dysfunction is.
So do most of your sports injuries happen because of the joints or because of like more muscle and ligaments?
I think you see a greater number of chronic injuries. So injuries that have kind of the slow onset are occurring because we have a lack of mobility in a certain direction, and then we compensate, and that compensation is what starts to create an inflammatory response. When you have an acute injury, somebody tears their ACL or somebody turns their ankle on a basketball court, that's going to be more ligamentous in nature. So you have to kind of look at, is it chronic overuse or is it acute sudden onset?
What would be an example of a chronic injury?
Patellar tendonitis, rotator cuff tendonitis, little leaguer's elbow, tennis elbow. Those are all good examples of chronic.
And then what would be the relation between kinesiology and athletic competitions? Like, how do they combine together?
Well, kinesis is really the foundation for normal movement, and so when you take that normal movement and now apply a specific movement for a given sport, gymnastics, for example. I love watching gymnastics because you can appreciate the kinesiological implication for where center of gravity is when somebody's on the rings, or when somebody is on the beam and they're doing a double back off the beam, and their center of gravity, and they land over this base of support, and their center of gravity is over that base of support and they stick it, or if their center of gravity isn't over the base of support and they fall. So you can kind of look at how this application of movement, center of gravity, the physics applied to those motions influence success or failure on any given athletic event.
How does your body react to sport-like movements like dodging, like running and sprinting? I guess name a few examples.
So let's use sprinting as an example, and we can look at the application of forces. So kinesiology is also the study of how forces are applied through the body and how your body responds to those forces. If you want to run faster, then we have this ground reaction force. So every time your foot hits the ground and you push off the ground pushes you back up. So that's called ground reaction force. And the harder you push against the ground, the more the ground pushes back up, the faster you go. So you can take an application like that and say, okay, if I want to run faster, I have to get my foot down faster and harder. If I want to go if I want to get faster, I have to be faster and hit the ground with more force. So that's kind of an application in a sprint. Now, the next component to that would be if I have any aberrant movements. In other words, if I've got an arm that's swinging out to the side instead of being in tight. Now my center of gravity is going to adapt to that change in position. I'm going to be less efficient. And if I become less efficient, then my performance will go down. So we can use those principles to look at some physics and some kinematics, which is more along the lines of the study of the movements, whereas kinetics is what are the forces, the kind of the physics applied.
Really interesting. Can you explain, Omar, how has kinesiology benefited athletics, like competitions?
Well, when you look at a good coach, and a good coach can apply those kinesiological principles to their athletes to decrease their chance more along the lines of improving their performance. So in other words, if I've got a pitcher and I've got a good pitching coach, then that pitcher's gonna, their hand, their elbow, and their shoulder and their trunk are all going to be in the right position when they're delivering the ball. And if they're not, they're going to lose velocity. The ball's going to start to rise, and they're going to get, people are going to hit home runs off them. They maintain that position. They call it in the slot. That's when they have better ball control. The ball can stay down. They can better movement on the ball. So you can apply those kinesiological principles to optimizing the correct movement to improve performance athletically.
So coaches really just learn kinesiology, something they can help improve your movement of your body.
Best coaches in the world are ones that have a really good, thorough understanding of kinesiology.
Based on your studies of kinesiology, what have we learned about this, and what do we still not know yet about it?
Well, we don't know what we don't know. But I think that we are, the things that we have learned is really the relationship between different types of muscle contractions and the relationship between entire linkages. So we look at the kinetic chain and how the foot and the ankle influence the knee, and the knee influences the hip, and the hip influences the pelvis. And I can look at a throwing athlete, for example, and go down and look at their big toe. Their big toe may be affecting how their shoulder is working. 30 years ago, we weren't thinking like that. Today, we have a much better understanding of that whole link between all the body parts.
So better understanding the relationship.
Much better understanding of the relationship. Yeah.
Then, what did we first know that kinesiology had to do with athletic performance, athletic competitions?
Well, when you really want to get down to it, you go back to Greeks, the ancient Greeks, and the original Olympics. They were figuring things out back then. So, it's just been a matter of we've increased performance from the ancient Greeks or the Olympics in the late 1800s when the modern Olympics returned to the current. You look at the current world marks, and they're much faster. We're much stronger, and athletes are bigger, stronger, faster today than they were even 30 years ago. And I think it's an application of physiology and eating better and being stronger and being more efficient and training more effectively and looking at the appropriate rest. And so we're looking at all of these factors, including psychology, the mental aspect of practice and performance. all those things together are really influencing progress in athletics.
Then for the Olympics, we have people like from different countries that compete around the world, and they're always the best. But how has kinesiology made them improve and become the best at it? Like they're best in their own country.
Well, that's also a good question, because when we're watching the Olympics on TV, we're really only seeing the countries who perform well. There are countries who send athletes whose performance wouldn't make the junior varsity team at any college in the United States. So, the application of a variety of kinesiological principles does go back to, where are we starting? In other words, do I have a really good athlete, and now I'm going to build upon the success of this really good athlete, or do I have a moderately successful individual, but in their country, they're the best in their country, but if we take them out of their country, we can apply the same principles to the Usain Bolts of the world, but if there is a genetic component that isn't going to allow everybody to run as fast as Usain Bolt, so we can apply the same principles, and everybody will improve, but they won't improve to the same level. And I think that comes back, comes kind of full circle to what's the genetic predisposition to any individual for that particular activity.
That was actually interesting. I'm not done yet. Okay, then question: what would athletes do to not prevent injury? What could they do to prevent injury?
To prevent? Well, the way I look at things from an injury prevention perspective is how aligned are they, and do you have what I call energy leaks. So if I don't have all of those body parts aligned well and functioning together correctly, I call those energy leaks, and that's when other structures are going to be abnormally loaded. For example, you're running and you go to cut, and you don't have the hip strength. You may have the hip strength, but you don't have the hip control. Or it doesn't come on quick enough, or it doesn't come on in the right timing, and your knee drops in and your ACL is torn. Whereas if you don't have that energy leak and you have the right motor control, then your knee drops in, but your hip engages, so that controls the femur instead of the ligament. So the ligament isn't torn, and the hip is controlling the motion. The hip muscles are controlling the motion. So that's for me, from an injury prevention perspective, is making sure that everybody has good motor control and their links are all working together. We don't have energy leaks.
So basic energy, if you keep all that energy within it, it will controls.
Yeah, it controls the motion.
Move.
Exactly.
Then how could we increase our athletic performance after discussing about the benefits of kinesiology?
Well, there's a lot that goes into performance, and even just the definition of successful performance is in and of itself something that one has to identify. But I think when you look at what are the principles that we're trying to apply, you have to say, what's an individual's goal, what are they training for, and what are all of the aspects that we need to apply. So do they have the strength, or can we maximize that? Do they have the mobility? Do they have the endurance? Do they have a representation of the pain threshold? So you remember, distance runners is, what makes a distance runner good? Because they can kind of block that pain out. When the going gets tough, sprinter stop. But what's the distance runner's slogan? My sport is your sport's punishment, because they like to run, and once they figure out that the pain's not going to kill them, they actually get a lot faster. So, understanding the difference between that discomfort and actual pain of an injury, and our perception of pain is that in and of itself, it's kind of that psychological side, is really interesting, because Imagine a linebacker. The linebacker at Brigham Young comes across and just rips the quarterback, hops up and doesn't think twice about it. Now imagine at 3 o'clock in the morning if he got up out of bed and sound asleep and somebody hit him just as hard. He probably wouldn't pop up because his state of mind he's in a different state of mind. So where we are from a psychological perspective has a big impact on performance both in practice and in competition.
So psychological is also a cause.
Yes, absolutely.
Wow. Is there anything interesting about kinesiology that you'd like to share with me that we haven't discussed yet?
Well, kines to me is just fun because it gives me a chance to look at how relationships work and movement patterns. I mean, I can go and I can sit in the mall and just sit there for hours and watch people walk by. And just the differences that people have in the way they walk is an indication of energy leaks, of muscle tightness or muscle weakness. So, having a good understanding of these kinesiological principles allows you to appreciate the world that we live in.
Okay. Awesome.
Sure.
Thank you, Jim, for this wonderful interview, and yeah.